If you're considering a facelift, you're probably wondering how long before the final results appear. Now this can vary according to the amount of soft tissue that is on the patient's face, because sometimes there's more swelling with more soft tissue and it can take longer for it to go down. It also varies with the amount of bruising that can happen as well. So there are gradual changes that are happening. There's early changes where the bulk of the swelling goes away and the bruising goes away, but there are subtle changes that can still take longer. So it does vary in terms of the amount of swelling that we start out with. So we do try to minimize swelling. We try to minimize bruising as much as possible. Some of the things that we do, first of all, we start 2 weeks before the surgery, we have patients discontinue supplements that are known to thin the blood. Obviously, we don't want them taking aspirin or Motrin or Advil, Aleve, any of those type of medications, because they have an effect on the clotting system. And so all those are stopped 2 weeks before, and we have them stay off till about a week afterward. Now, if they're on any of those medications prescribed by their doctor, for example, aspirin, we would potentially need to get their doctor's approval for them to go off of it, because they know best what the risk of them not being on the aspirin is. However, if we can stop all those beforehand, and then another helpful medication or supplement rather that we can use is called Arnica montana, and this is a herbal supplement that comes from a flower that's thought to reduce inflammation. A lot of people feel that they have less bruising when they start that, so we'll have them, we'll recommend that they may want to start that 3 to 5 days prior to the procedure, and take it even after the procedure. They also have a gel form that you can put on bruises that is thought to help accelerate the resolution of bruises, along with another enzyme called bromelain, that is an enzyme that exists in pineapple, but you can purchase it in a supplement form. So those are things that can help. Things that I think are also very helpful are icing right afterward. And so we actually provide ice to our patients immediately after their surgery and have them, we recommend that they ice as much as they can, especially the first 2 to 3 days, at least while they're awake. And so 20 to 30 minutes on each area while they're awake can be very helpful to reduce the bruising within the first early stages after the surgery. Another thing that we do is we use a medication called tranexamic acid, or TXA, and we put that into the numbing solution. Some doctors use it in an IV form, but I've found that just putting a small amount of it into the numbing solution has made a dramatic improvement in the amount of bruising that we see after surgery, so we've continued to use it. Sometimes we'll use steroids if there's anticipated to be a lot of swelling. Certain procedures such as lip lifts or brow lifts are known for having more swelling, and so if there's no contraindication to it, we'll have the patient use some steroids. We'll start with an injection during surgery and then give them medication to take afterward for the next week to help reduce the swelling. So these are all things that we can do. Compressive garments can be helpful. The hemostatic net sutures that we place have made it also another improvement to the amount of swelling and trying to keep the definition intact along the jawline and the bone structures. Even though there's still going to be some swelling that will gradually go down, we can see enough real changes at 1 month that it's worth taking some photos. Sometimes we can take them earlier if a patient is doing extremely well and doesn't seem to have a lot of swelling and dramatic change. We'll sometimes take the photos earlier. And we can always take more after photos. It's great that we have before photos because those can't be taken again, but we always look at how the before and the afters compare and can actually show patients, the results of that once we get to a point where we see a stable result. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.